Morning, everybody. Thank you for coming. I don't know if it's your thirst for knowledge or the free breakfast that got you here this morning, but I appreciate you being here. A little bit about me first. I was in private practice for about 12 years, first down in New York City, then I moved up to Rochester, where I've been practicing since then. And up there in Rochester, I started volunteering at the local shelter, going in once a week or every couple of weeks, doing rabies vaccines, examining some animals. And then the light went off over my head, and I saw that shelter medicine was for me, and as luck would have it, the shelter was going through a renovation, put in a veterinary suite, asked me to come on board, and now I've been there about 15 years or so. So I don't know if I deserve a medal or should be committed, but anyway. So this morning we're going to talk about rabies. I'm going to give you a little historical view of rabies through the ages, what rabies does, how it works, and then most importantly, are you at risk working with animals in the shelter? Can you contract rabies? What would happen if you do? What's the whole story with that? So first I want to take a little poll. How many of you do work directly with the animals? Good. Almost everyone except for Elizabeth over here. How many of you have ever been bitten or scratched by one of these animals? Okay. How many of you have had at least a fleeting thought about rabies after that's happened? Okay, some of you, that's good. Okay. So first off, rabies kills about 55 to 75,000 people a year worldwide. No one really knows exactly how many. Part of the reason is that it's, first of all, underreported around the world, especially in third world countries, and even underdiagnosed, even here in this country, which we'll see later. So here's a quote. It's a little quiz we'll start off with, excuse me. You could read it for yourselves. Who am I? Who is this talking about? Is it this guy? For you younger people, my daughter said, "Dad, why don't you put a picture of one of those Twilight guys on?" I said, who? What? What are you talking about? Is it some of these people that fit the description of that quote? Or what about this cute little puppy? Oh, wait a minute. It's rabies. It's someone with rabies, not a vampire, not a zombie, but a rabid animal that quote's referring to. So rabies has been around probably forever. Probably people in one way or another have been thinking about rabies since dogs started sitting around the campfire way back in early history. This is what the rabies virus looks like. It's a bullet-shaped virus. It's in the rhabdovirus family. Lyssavirus is the genus, and that's all we'll worry about scientifically. Even 4,000 years ago, they were talking about rabies. Archaeologists found in some slab, someone wrote an inscription, "For a man whom a rabid dog attacks and to whom it passes its venom, I do not know what I shall do for that man." Obviously, they didn't know rabies was a virus and so forth, but they knew something bad was happening when these dogs were acting crazy and would bite someone, and this person would then die a horrible death. Moving on, the ancient Greeks, Homer in the Iliad writes about Lyssa, which is an animal state beyond anger, rage, or madness. Aristotle, in his book, History of Animals, he wrote the dogs suffer from 3 diseases: gout, sore throat, and rabies. I tell you, vet school would have been a lot easier if there was only 3 diseases I had to learn. Moving ahead, 10th century Baghdad, and a doctor wrote about a patient in a hospital there. There was with us in the hospital a man who barked during the night and died, and he did not drink water and said it stinks and the stomachs of dogs and cats are in it. Some ancient cures for rabies, actually. The Romans would take the hair off the tail of the dog that bit somebody, burn it into ashes, and put the ashes on the wound, and that's where the expression tail of the dog comes from, actually. The Chinese, ancient Chinese, would take the brain out of the rabid dog and rub it on the wound too to try and cure the person. Obviously, these things didn't work too well. Moving ahead, in 19th century Europe, that became the time where people started having dogs as pets and keep them in the house. And that was great, except unfortunately it led to big rabies epidemics. And in the late 1800s, they actually would round up the dogs and kill them because they were feared of rabies affecting people. So finally, in the late 1800s, Louis Pasteur, when he was done playing around with milk and pasteurized it, set his sights on rabies. So he worked with, that's after they found out that the germ theory of disease, that germs carry disease and not evil spirits or whatever may be going on. So he worked with rabbits and took passed the virus to rabbits and through different rabbits, generations of rabbits, to weaken the rabies virus enough to use as a vaccine, and first he used it on dogs, and then he actually, somebody had a child who got bit by a rabid animal, and they came to him, and he actually used it on this 9-year-old boy for the first time in 1885, and the boy did not come down with rabies, and it took off from there as far as vaccinations. In early 1900s in Brazil, all of a sudden all these cows and horses were getting this paralysis in their rear legs, where they'd be looking like they were sitting in a chair. Then they were having trouble swallowing, they were foaming at the mouth and dying, and then a few years later they finally isolated Negri bodies from their brains, which is a way to diagnose rabies. They look for these little inclusion bodies inside some of the brain cells, and so now they finally figured out these animals were dying from rabies, and then a few years after that, they didn't know where these animals were getting rabies from, but then finally they isolated it in bats in Brazil that were the cause of rabies. The first confirmed rabies case due to bats in the United States wasn't confirmed until Florida in 1953, when some boy was bit by a yellow bat during the day, and they captured the bat and were able to isolate the Negri bodies from that. So here's another quiz. Since the 1980s, what animal is most frequently found to be infected with rabies? Anybody? Raccoons. Wow, you guys sat through this before. You're right. A friendly raccoon there. Before we get to this. So somebody had the bright idea in the mid-1970s. Before that, raccoon rabies was really confined to the southeast, northern Florida, Georgia, Alabama, way down there. And in the mid-70s, someone had the bright idea, let's trap about 4,000 raccoons from down there and ship them up to Virginia for people to hunt. So they did that, and of course many of the raccoons escaped, and of course many of the raccoons had rabies. And that's how kind of raccoon rabies took off throughout the East Coast. You can see on the map on the left, that's rabies and raccoon rabies in the mid-1970s, and on the map on the top right in the mid-1980s, already we see there's a big cluster in Pennsylvania, Virginia, Maryland, around the mid-Atlantic states. And then the map on the bottom is raccoon rabies in 2006, and it's all along the northeast. The red areas are the most concentrated areas of rabies, and we see it's all along the northeast now because of that trapping and releasing, so to speak, from the mid-70s. And raccoons apparently thrive in urban and suburban areas. They're able to get in and out of garbage cans and eat whatever's around, so they're just situated to live in populous areas. So here we are in New York. So where's the largest density of raccoons found? Adirondacks? Anyone think the Adirondacks? New York City? A couple of people. Catskills? A couple of people. New York City has the largest amount of raccoons. I grew up in New York. I mean, I used to see rats all the time, big cockroaches, but way back in my day, we didn't really have raccoons down there, but now it's very common. In fact, in late 2009, early 2010, there was a big raccoon outbreak in Central Park. So moving on, so How is rabies transmitted? Most of you know this. It's through infected saliva, through bites, scratches, through mucous membranes. Also through transplants, corneal transplant, organ transplants even. In 2004, there was an organ transplant. They harvested organs from someone, and it was 4 people received the organs, and unfortunately a few months later they all died of rabies. More recently, in 2011, sorry, a person died of encephalitis. They did not find the reason why this person died of encephalitis. It was a brain inflammation. And his organs were harvested, given to 4 people also. And 17 months later, early 2013, the person who got the kidney died of rabies. The 3 other people did not come down with rabies. The investigators really don't know why they didn't, but fortunately they're okay. They started in with the post-exposure treatment and they're doing fine. The big problem with rabies is the incubation period. That's the time from when the virus gets into the body to when you start showing symptoms. The incubation period is very variable. It could be anything in animals from days to weeks, and in people even months and years. Years you could have the virus in your body just hanging out, and then all of a sudden it gets up to your brain and causes problems. And the virus goes from the bite site, gets down into the nerve tracts, bypasses the bloodstream where most of your body's defenses are to fight off any kind of infection. So it gets into the nerves, works its way to the spinal cord. And from the spinal cord, takes the direct route up to the brain. And that's when symptoms start. And then the virus spills over into the salivary glands, and that's how it could be passed through saliva to the next victim. If you get to the point where the virus has made it to your brain, let me put it this way, don't make plans to attend next year's conference. And investigators have found that the virus travels about 1 to 2 centimeters a day on average. So it takes a while to get up to the brain. If you're bitten on the toe, it's certainly going to take a lot longer for you to develop signs of rabies than if you were bitten on the face. So what are the symptoms of rabies? Well, most of us know these. There's a couple of different phases. There's an early phase where you might see some lethargy, the animal might have a fever, not eating. Behavior reversals happen sometimes, meaning if you have a dog that sits by you all the time, all of a sudden it's going to be very aloof and not want anything to do with you. A cat that's just hanging out, and maybe a mouse, or all of a sudden is going to become a lap cat. Humans talk about pain at the bite site starting, flu-like symptoms, headache, insomnia, things like that. And that lasts for a day or two. And then it could progress either to the furious stage or the dumb stage. And in the furious stage, we see irritability, aggression, viciousness. That's kind of like me before my morning coffee, but self-mutilation, seizures in some animals, hypersalivation. In people, about 80% of people go through this furious stage. They have mood swings, hallucinations, violent behavior, hypersalivation. And then finally, some people, hydrophobia, fear of water. And that's kind of the kicker. That's when all the lights go off over everyone said, oh, this person has rabies, when you finally get to hydrophobia, if you get to that. Or instead of the furious phase, you could go into what's called the paralytic or dumb stage, where you have a progressive paralysis, also hypersalivation, inability to swallow. Only about 20% of people go through this dumb phase. So it's much harder to make the diagnosis unless someone says, oh, I got bit by a raccoon the other day or whatever. Muscle spasms, paralysis, you don't have the behavioral changes. Many of these people do not show fear of water, therefore no one's thinking rabies. And the longer you wait, obviously, the less chance that you're going to survive. Usually you end up dying due to respiratory muscle paralysis, and your heart's not working right either. How is rabies diagnosed? Well, in animals, we euthanize them and take a section of the brain, and they do what's called a direct fluorescent antibody test, where anti-rabies antibodies are mixed with these brain cells where presumably there's the rabies virus or antigen, and when it mixes together, it turns that green color, fluoresces green, and that's how they diagnose rabies. Or sometimes in the older days, they used to use these Negra bodies if they found them inside the brain cells too. Obviously in people pre-death, they're not taking a section of your brain out. Most people don't have enough to spare anyway. So they're looking for antibodies in the saliva, in the serum, in the spinal fluid. They also do a skin biopsy, a full thickness skin biopsy in the back of the neck and look for antibodies there. The big problem is antibodies don't come along till about a week after the virus has made it into your brain. So it's a lot harder to diagnose, and by that time you're just about dead. So here's some stats that I thought at least were interesting. From the Journal of Wildlife Diseases, if you line up a bunch of rabid animals, a fox, a cat, a horse, or whatever, the fox is the most likely animal to bite you in an encounter. And a gray fox more so than a red fox. Why, I don't know, and who sat there and figured this out, it's beyond me, but 70% of cattle, 80% of sheep go through the furious rabies stage. Less than 10% of rabid ferrets show aggression, so most of them are very docile and you're not even going to know or suspect rabies. 55% of rabid cats and 31% of rabid dogs bite people. I thought it'd be a lot higher than that, but I thought that was interesting. Some more stats. Back in 1947, about 7,000 dogs in this country were diagnosed with rabies. Fortunately, today, only 70. So obviously, with vaccinating our dogs, it's come a long way in preventing rabies. And in fact, the dog rabies virus variant doesn't even occur anymore in the United States. Our dogs have either raccoon or skunk or bat variant rabies. Human deaths in the 30s, 250 people a year in the United States were dying of rabies. Now it averages about 2 per year. So that's a big improvement too, fortunately. So we've seen a little bit about rabies through the years, what it does to you, how it works, how it's kind of tapered off in the years, fortunately, since the early 1900s. So what about you now? What about working with animals in the shelter or whatever organization you're with? Are you at risk? Are you potentially going to come in contact with rabid animals here in New York State? Here's some stats from 2011. New York State was number 5 in the country in rabies, total rabies in 2011. That means domestic animals and wild animals combined. Number 5 in the country with 381 cases. And we were number 3 in the country in domestic animal rabies. Dogs, cats, horses, cows, all those things. Number 3 in the country. And the graph shows the breakdown of all the cases from New York State in 2011. We see there's 1 dog on there, 7 cows, there were 38 cats, and obviously raccoons took the lead with 162. But looking at the 38 cats, 25 of those cats that had rabies were feral. So keep that in mind, those of you who do trap, neuter, and release. 9 were owned, and 4 were stray cats. Here's a county map of New York State. For those of you who are not geographically challenged, you can find your county and see how many cases of rabies were confirmed from your county.
What's the first number?
The first one where?
11/.
Oh, the first number is the positives out of how many samples that were sent into the lab for diagnosis.
Thank you.
As an aside, I find it interesting that Erie County sent in 863 samples, thanks to Dr. Chevalier over here, where Monroe County, where I live and practice, and where Rochester is, we only sent in 119. Now, what's interesting to me is I think every county health department takes a different view of rabies. In our county, we've been told unless the animal is showing signs we think it has rabies and it bit somebody, they don't want the body. So if an animal comes into our shelter, it's foaming at the mouth, it has a neon sign over its head flashing rabies, 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 if it didn't bite anyone, our health department doesn't want us to submit it. Erie County apparently is different, where if you're just walking along the street and someone says, look at that baby, oh, rabies, okay, let's send it in. So it's interesting to know what different health departments do throughout the state. And obviously with budget cuts and economic problems, they probably don't want to take as many samples and have to process them either.
Notably in Erie County, there were 24 positives for those 800.
Right. I mean, probably the more you sent in, the more positives you'll have also. So in 2011, Westchester was the grand prize winner with 61 cases. Erie County was second with 24, one cat. Tompkins County, where we are today, had 8, no domestic animals. Monroe County, where I live, had 5, 1 cat, which we'll talk about a little later. Taylor County is the one with the 1 dog. So let's talk a little bit about rabies in Monroe County, where Lollypop Farm is, where I work and live is. In 2000, there was a visiting professor from Africa who came to SUNY Brockport. Apparently he was bit by a puppy before he left his country, came here, 6 months later, dies of rabies. In 2003, there was a rabid fox, jumped into someone's yard and attacked a 5-year-old girl. 2008, in the town of Parma, some homeowners came out to their backyard, saw their 2 dogs wrestling with a raccoon. They were able to kill the raccoon and preserve its head so they could send the brain out for analysis. Turned out the raccoon had rabies. Of course, the people's dogs were not vaccinated. So they decided to quarantine the dogs for 6 months. And unfortunately, 2 months into the quarantine, one of the dogs started showing signs of rabies and they both had to be euthanized. Also in 2008, in the town of Churchville, a woman pulled a bat out of a swimming pool that had rabies. In 2013, a woman was walking her cat one day. This woman works at Lollypop, by the way, but she's in administration, so that explains a lot. And she and her cat, unfortunately, were attacked by a raccoon that ran away, and she had to go through the post-exposure treatment now. So this is Daisy. This was my dog. She was a slightly overweight, 185-pound English Mastiff that we got from rescue way back when, and she was about 11 years old or so in 2007. And we live in your typical suburban housing subdivision. Our backyard backs up to other people's backyards, no woods over there or anything. And one morning I let her out to go do her thing in the backyard, and she waddles outside and she's out there. And all of a sudden I hear her barking, and she had a loud, deep bark, barking and crying, and sounds that I never really heard her make. So I go look, I open up the patio door, and she's wrestling around with something on the ground way in the backyard. And so I don't know what's going on, so I scream, Daisy, Daisy. So she gets up, she runs as fast as she could. I haven't seen her run that fast in years. She was arthritic, she had other health problems going on by that point. And I see something's following her. So she barely makes it in the house, and I try to slam the door closed, and halfway in the house is a fox. So the door is holding the front half of the fox in my house and the back half out of the house. And I look at Daisy, and she's all bitten up around her rear end and her hocks and her legs, and there's blood coming from her. And I look at the fox, and he's spitting bloody saliva on the floor and on the wall. And then my wife comes downstairs, and she's like hysterical, and I don't own a gun. So I have my wife hold the door, and I go get a broom, and I'm going to try and push the fox out with the broom. And the fox grabs the broom and shaking it. And then finally, we were able to push the fox back outside and slam the door. So and we never caught the fox, but you tell me. So this fox is running around the backyards, broad daylight, attacks a 185-pound dog, and then tries to follow it inside a house. If that fox doesn't have rabies, I don't know who does. Moving along, this was Emma. This is the kitten that Monroe County had, the 1 cat rabies case. This kitten came into our shelter, was admitted as a stray in July of 2011. It was 6 weeks old, 1.5 pounds. Its right rear leg was mangled, there were bite wounds on it, and its other foot had some bite wounds on it. And it looked like the bite wounds were about 4 or 5 days old. Didn't just happen that day. So we stabilized her, gave her antibiotics, fluids, et cetera, et cetera. Decided to amputate the leg. She recovered from that. A few days later, we noticed that her toe on one of her other feet was really nasty looking, and we amputated that. She recovered from that without a problem. One of our new technicians actually, decided to take her into foster care. It's great, so let her recover. Then she decided, well, I'll just adopt her and keep her, and okay, that's great. So 2 months go by. The technician was off that day. All of a sudden she calls us in the clinic, and I'm talking to her on the phone, and she says, I don't know what's going on with Emma. Yesterday she was very lethargic, she wouldn't eat, she was laying there. She actually threw up some roundworms and some fluids, so I'm like rolling my eyes, how does she have roundworms? We wormed her a million times, what's going on, and et cetera. And then she continues with the story, and this morning, so I separated her from the other cats and the dog, and I put her in her own room overnight, and this morning, she's ravenous, she won't stop eating, she's vocalizing, she's screaming, and then this afternoon the vocalizing is getting louder and she's carrying on and she's scratching at the door to get out and throwing herself against the door and she's acting real weird. And then I went in there to calm her down, I'm sitting with her and she bit me on the foot, on the hand, on the thigh. So I hearkened back to when this kitten came in. And I'm pretty impressed because I can't usually remember what I had for breakfast in the morning. But I remembered what she looked like when she came in. So I said, Kelsey, I think we have a problem here. You need to bring her in. I think she might have rabies. So she hung up the phone. She was coming in with that. I said, oh, I got to go. Sorry. And then I left and left the other vet there to deal with this. But no, seriously, I did have an appointment or something. So I didn't see the kitten when she came in, but the other vet told me she never saw anything like this in her life. The kitten was acting like she was possessed. Never saw anything like it. They euthanized the kitten, sent the head out, and sure enough, she's positive for rabies. So let's think about this for a second. First off, it's a little strange. I mean, how does a 1.5 pound, 6-week-old kitten survive an attack from a rabid animal? That's mind-boggling to me. Secondly, what would have happened if our technician did not adopt this kitten? We were fortunate, quote unquote, that she did, that it was in her house, somebody who has some knowledge about rabies and what goes on with it. A cute little kitten like this, 3 legs, she would have been adopted in a heartbeat from the shelter. What would have happened if this kitten was in someone's house? People, let's say, have kids, got plenty of kids playing with the kittens day in, day out. How many people would have had to have gone for post-exposure treatment? A lot, probably. What kind of PR message does that send also? Oh, come to Lollypop Farm and adopt a kitten. It comes spayed or neutered, it comes vaccinated, dewormed, leukemia tested. Oh, and as an extra benefit, it could have rabies too. How many people are going to come in and adopt an animal after that would hit the press? So we were very fortunate in that sense that it was in the technician's home and not adopted out. What happens if the kitten was at Lollypop waiting to be adopted? What happens if she was in a cattery with other kittens? All those kittens would have been euthanized. What happens if she was in a cage by herself? You have staff interacting with her, volunteers interacting with her, the public coming in and maybe looking to see if they wanted to adopt her and interacting with her. What about the public health nightmare that would bring? Trying to find all the people that potentially interacted with her as she developed signs of rabies. Another bad thing about rabies is in dogs, cats, and ferrets, they could be shedding the virus a few days even before they show symptoms. So you're extra screwed with that. So what should we do? What kind of policy should we adopt in these kind of cases? I don't have the answer. In Massachusetts, for example, they have a regulation that if an animal comes into the shelter with bite wounds of unknown origin, the animal either has to be quarantined for 6 months or euthanized. Who has the ability to quarantine an animal for 6 months in their shelter? Most of us don't. Who wants to euthanize animals that come in with bite wounds? Most of us don't, certainly. People bring in animals all the time. They have bite wounds. The admission people will ask them, oh, well, how'd this dog get this bite wound over here? So, you know, the admitters might say, oh, he was fine with the dog next door, or the cat was fine with another cat in the house, whatever. But, you know, we all know admitters sometimes don't remember the facts, not forthcoming with the facts, or how can I put this gently, they lie and lie and lie when they bring in their animals. So that's one problem with that scenario of bites of origin. How many animals come in that have bite wounds that have healed, that we don't even know they have a bite wound? Or it's just a little scratch now. Well, I don't know where that was from. I mean, what are you going to do? You know, you run into this problem all the time. And rabies could take, in this little kitten's case, even 2 months from infection to symptoms. So what do you do with these animals? I don't have the answer. We discussed this at the shelter for a while, and no one could come up with a plan to avoid this scenario again and for getting worse. We're certainly not going to start euthanizing animals because they come in with a bite wound, but it can turn into a big problem like this almost did. What do you do in your shelters? Do you have any kind of protocol as far as what happens when an animal comes in with a bite wound? Are you quarantining for 6 months to make sure it doesn't come down with signs of rabies? Are you euthanizing it? Are you turning it away? I don't know. Moving on, in the 10-year period between 2002 and 2011, there were 24 human cases of rabies in the United States. 4 of them were from organ transplants, which I mentioned earlier. 13 of those people had direct contact or were bitten by an animal. But here's the kicker. 7 people who came down with rabies had no obvious animal contact. They have no clue how these people got rabies. That's pretty scary when you think about that. Some cases from 2011, a 24-year-old soldier serving in Afghanistan was bitten by a dog on the hand, comes home, he's in New York. 8 months later, all of a sudden he's suffering from some neck tenderness, inability to swallow. It progresses to the point where he's showing full neurological symptoms and dies of rabies. A 40-year-old Massachusetts man has leg pain, inability to swallow, confusion, he has weakness, fever. His symptoms also progress to full neurological symptoms. He dies of rabies. They analyze what kind of rabies he has, and it's a subtype that's only found in dogs in Brazil. When questioning his family, well, was he in Brazil recently? So actually he was in Brazil, and he was in contact with a dog that might have had rabies or was acting pretty strange, but it was 8 years earlier. 8 years this virus was hanging out in his body, and then all of a sudden it took over. We'll wait for you to answer. Do you want me to talk to them? Another Massachusetts man, a 63-year-old man, develops elbow pain, inability to swallow, and then hydrophobia, dies of rabies. Turns out he woke up one morning and 2 or 3 months earlier and found a bat in his bedroom. No history of bite from the bat or anything. The bat's just hanging out in the bedroom. 2 months later, he dies of rabies. In fact, usually if you do find the bat in your bedroom, in your house, and you don't know what was going on, you're supposed to get treated prophylactically for rabies anyway, because apparently you could get bit by a bat and not even feel it. An 8-year-old girl in California all of a sudden is having sore throats, fever, difficulty swallowing, progresses to paralysis, convulsions, neurological symptoms. She's diagnosed with rabies. Turns out 2 months earlier she was scratched by a cat in a feral cat colony near her school. Fortunately, she survived. The reason is because of this, the Milwaukee Protocol. This is the treatment that's currently tried, and I emphasize tried, on people who have symptoms of rabies. It was first used in 2004 on this teenage girl who was bitten on the finger by a bat that turned out to have rabies, and she developed signs of rabies. And what happens is you're put into a medically induced coma with ketamine and midazolam, which some of us use to induce anesthesia in our animals also. You're given antiviral and symptomatic treatment, and the theory is you're giving your body time to develop antibodies to fight off the rabies virus. Because the thinking is rabies doesn't destroy the brain, it just keeps the brain from doing what it's supposed to do. So if you're in a coma and you're artificially, you're on a ventilator, your heart rate is stabilized, those kind of things, and you survive long enough, your body will fight off the rabies virus. So it's worked in 6 people out of 35. So for 29 people, sorry, it did not work. 3 of the people who did survive, unfortunately, have profound neurological problems. So once again, I want to emphasize, if you are bit by an animal, it turns out it had rabies, if you don't do anything about it, if you wait till you have signs of rabies, you're probably not going to survive. So here's where I work. This is Lollypop Farm in Rochester in Monroe County. And this is our intake stats from 2009, 10, 11, 12. So in 2009, we took in about 13,000 animals. About 4% of those animals came in with some kind of rabies vaccine history. 2010, 12,500 or so. About 3.5% of those animals came in with rabies vaccines. And 2011, 12,000 animals, only 3% of those came in with rabies vaccine. 2012, about 12,000 animals still about 3% came in with a history of rabies vaccine. So that means 97% of the animals, of the dogs and cats that come into Lollypop Farm, we don't know their rabies status. We don't know if they've been in contact with an animal that had rabies, if they were bit or scratched by an animal in the past that had rabies. It's a blank slate. All those animals potentially could have rabies that we're coming in contact with and working on and with. So what about rabies shots, though? Are they effective? Are they 100% effective? Anybody have any guess? How effective are rabies vaccines in animals? Okay, then. A study in the Journal of the American Veterinary Medical Association in 2009 showed that 5% of the dogs and about 2.5% of the cats who were confirmed with rabies were previously vaccinated. So if you're putting all your trust in the rabies vaccine that the animals have gotten, it's foolish, because there are still some dogs and cats that will come down with rabies even being vaccinated. No one really knows what happened. Was the vaccine not given correctly? Was the animal immune compromised and couldn't mount a response to the vaccine? They so overdue from the vaccine that their immunity is plummeted? Nobody knows. But it's pretty scary that even when you get in animals with vaccines, that perhaps it's not going to be effective and protected. And if the animal already has rabies in it, you could vaccinate it every day and it's not going to help. They're going to come down with rabies. At Lollypop Farm, we have a large animal part, hence the word farm in Lollypop. We have cows, horses, goats, sheep, emus, ducks, goats, geese, all kinds of things running around. We back up to this big wooded area. We have a whole petting area for people to come in and hang out with the sheep and goats. We know we have foxes because unfortunately we lose a couple of geese and ducks to fox attacks every year. We know there are raccoons around in Monroe County. What about these guys? They certainly could get rabies too. We vaccinate them all for rabies, but is it 100% effective? Who knows? For the goats, it's off-label because the vaccine is not even approved for goats. What about the people who are coming in and hanging out with these animals and petting them, and the sheep and goats are slobbering all over these little kids, and who knows what's going on? Fortunately, nothing's happened, but it's certainly a potential risk. So now let's talk about us and in what happens in your organization. Does your organization have a written SOP on what happens if you are bit or scratched? Yes? No? Everybody have one in their organization? Everyone know? Good. Some people haven't shaken their heads, so I don't know. Is it written? Or you just go around and say, oh, if you get bit, just do this, that, and the other thing. But you need to have a concrete written statement on what should be done. Even if it's written down, is it followed? Are people, if they are bit or scratched, are they filling out the proper documentation? Is it enforced? It's sad, I'm sad to say that even where I work in my clinic, some of the techs and assistants, when they get scratched or bit, don't report it. Don't say anything about it. Why? Because they don't want these animals put on a 10-day bite hold to see if they develop signs of rabies. They don't want them potentially euthanized after the rabies hold is up, assuming they don't show signs of rabies, because, well, now this maybe is an aggressive animal and shouldn't go up for adoption. So they don't fill them out. But it's my job to yell at them for numerous things, including this, to make sure they are filling this thing out, to make sure that they are protected in case this animal would end up having rabies. What about the location of the animal that did bite or scratch? Are you taken out of the general population? Is it being put in isolation or quarantine somewhere by itself? Or are you leaving it in the cattery with the other cats? Or in a dog group, a play group or whatever, and leaving it up front for everyone to come and see and play with and touch? And who's doing the evaluation of the animal when it's in quarantine? Is it a vet, a tech, a staff member with knowledge? Or is it the bookkeeper from administration or the pizza delivery guy to the shelter? Who's watching this animal? Who's looking at it to make sure during that 10-day period it's not showing signs of rabies? Here's some bite incidents from Lollypop Farm where I am and our local municipal shelter, Rochester Animal Services, over the last couple of years. So people are getting bit. This doesn't even include scratches. This is just bite wounds. Think about how many bites go on from animals in your organizations. In our place, we were in the teens most of the time. In 2012, we had a big increase, and what happened was we got a lot of new staff in 2012. And who gets bit? Usually the new staff, until they learn how to handle the animals and what to do. So we had a big increase then. But it's a problem, it happens a lot. So, the bite reports are filled out, the accidents reports are filled out, and the animals certainly are put in quarantine, and we're monitoring them to make sure they're not showing signs of rabies during that time. So, we've seen that rabies is in New York State. We know raccoons carry. We see raccoons are all over the place. We see these animals are coming into shelter with unknown rabies vaccine status. We know they come in with bites and scratches. Sometimes we don't even know they had bites or scratches. People aren't giving us the whole information. Rabies could take weeks to months in animals to show itself. Are you safe working with these animals? That's the question. And what could you do to protect yourself? So the U.S. Public Health Service, their Advisory Committee on Immunization Practices, recommends that anyone in the frequent rabies risk category get pre-exposure vaccinated. There's 4 categories. There's continuous, and that's for people who work in rabies labs and with the virus. There's frequent, which are people who work with animals in a rabies endemic area, which is us. There's infrequent, where people work with animals in a non-endemic area, and then there's, I think, uncommon, which is just for the everyday public. So we work in the frequent risk category area. How many of you are pre-exposed vaccinated? Good, most of you, about 2/3 of you, that's good. A study just came out in this recent JAVMA, actually, of a survey of animal workers in West Virginia, which is also endemic for rabies. 93% of the vets are vaccinated who work in West Virginia animal hospitals, but only 29% of the techs and the assistants are vaccinated. That's crazy. I know in the clinic, part of the job description for our techs and our assistants are, it's your job to get bit and not let the vets get bit. So if anyone should be vaccinated, it should be them. You need to be vaccinated. If you work in a shelter in New York or any other endemic area, you need to be pre-exposed vaccinated. So at our shelter, Lollypop Farm will pay for the vaccines after working there 6 months. As I said, who gets bit usually? The new workers. But they still have to wait 6 months until Lollypop will pay for it. And the vaccines are expensive. So, you know, it's tough. You know, economically, well, should the shelter invest this money in these people who might not last 6 months? We've had people go out for lunch, never come back, even. So, do you want to invest all that money in them? It's about $900 or so for the pre-exposure series. It's a hard call. At RAS in the city of Rochester, they get vaccinated when they're hired. In Erie County, it's a little murky from the information I got. Basically, I was told that the full-time kennel staff get vaccinated, the veterinary staff gets vaccinated, 2 of the wildlife volunteers get vaccinated. Apparently they have a big wildlife department there, and they have about 60 wildlife volunteers, and only 2 of them are vaccinated. It's nuts. And even with that, Erie County does not pay for tighter checks every 2 years to make sure that everyone's immunity is where it should be with rabies. At Denver Dumb Friends League, one of the premier shelters in the country out in Colorado, gigantic budget, they don't vaccinate their staff for rabies there. At Tompkins County here, I was told, I don't know how true it is, yes, the staff is vaccinated, but at least the people I spoke to, no one knew the procedure or when they're vaccinated. Do you know?
I know that when you're saying random, like some of the staff is vaccinated, the ones who have been there for a particular length of time, although there's no like 6 month written in stone.
So it's
Yeah.
kind of
It's
hit or
murky.
miss.
Mm-hmm.
At Barks, which is Baltimore Animal Rescue and Care Shelter, down in Baltimore, Maryland, where it's also endemic, upon hiring there. What happens in your shelters? Are you vaccinated right away? Anybody? How long after you're working there do you get vaccinated? Or does your shelter even pay for your vaccines? A lot of people are shaking their head no. It's crazy. Maybe administration should put their economic resources into you guys instead of coffee and donuts sometimes. So let's talk about the pre-exposure vaccines for a moment. Basically, it's a series of 3 intramuscular injections, and at least in 2011 in Monroe County, it cost $825 for the series of 3. And after that kitten incident with Emma, everyone went to get vaccinated in the shelter who hadn't gotten vaccinated. So it cost Lollypop in one chunk about $22,000 for the people who weren't vaccinated. But had to be done, or should be done. Lollypop doesn't go out of its way to tell people, oh, you've been here 6 months, you could go get vaccinated now. They leave it for them to figure out themselves. So even with pre-exposure vaccinations, you still need to go through the post-exposure series, but it's not as drastic. You do not need to get the immunoglobulin injection, which I hear is extremely painful. You don't need 4 shots, you only need 2 shots post-exposure. You've had the pre-exposure injections. It might help a little bit if post-exposure treatment is delayed, if it takes a long time for some reason to get the results back on the specimen, if it does have rabies. And certainly it might help prevent you from getting rabies when you don't know you've been bitten by an animal that has rabies. If there was a bat in your bedroom for some reason, and flew out again and you didn't even know it was in there, whatever the case may be, or you had a mild scratch or a bite from an animal that went on its merry way and you never found out it had rabies. Here's another quiz. So what happens if you are bitten by an animal that tests positive for rabies or runs off and can't be found? Well, if you do nothing about it, as I mentioned, you're going to die. Otherwise, you could go through the post-exposure treatment, which you should. And the post-exposure treatment ends up costing the shelter more money because now you're throwing in more vaccines, the immunoglobulin injection also. About 40,000 people in the United States are treated post-exposurally, if that's a word, every year. Nobody, from research I could find, nobody has ever died from rabies who's taken the post-exposure vaccine. So that's great. So you're going to be cured and you don't have to worry about it. Remember, you could only develop rabies if you're bitten by an animal that has rabies while it's shedding the virus. So a couple of days before it's showing signs in a dog, cat, or ferret, or during that usually week or so period when it's showing signs of rabies, all the signs we spoke about earlier. So if you're bitten by an animal and a month later it develops rabies, you don't have to worry about that. But that's why you have the 10-day bite hold, to give it that week to see and the extra few days to make sure it doesn't show signs of rabies in that time, meaning it was not shedding the virus in its saliva at that point. If you go on the New York State Department of Health website, you can find a protocol for who's entitled to get post-exposure vaccinations, what does an exposure mean, and what are the different variables to see if you supposedly qualify to get post-exposure vaccinated. Back to the story about Emma, that little kitten who had rabies in our shelter. So obviously the tech who was bitten and her boyfriend in the house certainly went for the post-exposure treatment. They live in a different county, actually a neighboring county, so it was done there. So our vet and the two techs who helped the vet euthanize the kitten wanted to go for the post-exposure treatments. They weren't sure if they got bit or scratched. You know, we all have our scratches and bite wounds just from, working with the animals anyway, any open wounds. They didn't know, was the kitten spitting on them, saliva going around, whatever. So they wanted to go for the vaccine. So the health department first said, no, you don't need the vaccines. You weren't bit or scratched. You can't say you were. So no, you don't have to go for them. So there was a big stink made. We investigated with the Erie County Health Department, some other health departments to see what was going on. The technicians called their doctors, and the doctor said, yeah, of course you have to get the vaccine. So finally, the health department acquiesced and said, okay, you could go for the vaccines. So they go for the vaccines, and, not that the medical staff is up to date on rabies, they don't see it, they don't work with animals, the medical staff in the hospital, but they couldn't figure out what to do for the vet and the two techs. They wanted to give him the immunoglobulin injection. They wanted to give him the shots in the rear end where you're not supposed to get. You're supposed to get in the deltoid muscle. They wanted to do all kinds of things, and no one knew what to do. So fortunately, the staff, having some kind of knowledge, was able to explain to the medical staff at the hospital what needs to be done. So it could have turned into a big nightmare. As an aside to the story, how crazy medical health care could be, sometimes after a vaccine, the doctor or the nurse puts a Band-Aid on the area. So apparently the nurse opened up a Band-Aid, stuck it to her own arm, and then put it on one of the workers. So the moral of the story is you need to be informed, you need to monitor your own health care, whatever the case may be, and don't be so trusting that everyone knows what they're doing with that. So if you have been pre-exposed vaccinated, you only need 2 rabies vaccines after that, and you should be fine. So what's the bottom line in all this? The bottom line is rabies is here. Rabies could easily come into your shelter, into your rescue group, into your organization. You need to be protected. If your shelter is not giving you paying for your pre-exposure vaccines, you need to keep bugging them until they do, or if not, you should pay for them yourself and to be protected. Don't ignore bites and scratches from any animal that comes in, even if it has a history of rabies vaccine. You never know who they were in contact with. You never know what could be lurking and what has come out. And if you do develop rabies, signs of rabies, you're probably going to die. So here's another hard day at work at Lollypop. Notice they're all smiling with me on the surgery table. I wonder why.